Hi, I'm Dr. Tam Cummings, and I'm a gerontologist that specializes in dementia. This is part 4, the 9 most common dementias. You're in the Dementia Caregiver Education Series provided by the East Texas Alzheimer's Alliance. Remember to watch the series in the order because the information builds on the previous session. After the 9 most common dementias, we will do tools for staging dementias to help you and your physician better understand where your person is. And then finally, we'll talk about caregiver stress, grief, and guilt. Now, there are 7 stages in dementia. And forms that use 3 stages, those are staging tools used for neurologists that are doing research. Otherwise, we use 7 stages of dementia as a way to help us understand the progression of the disease, because with each stage, there is more and more brain damage, and your loved one begins to display more and more behaviors. Now, what's interesting to me in this picture is that these 3 ladies are in 3 different stages of dementia. The lady whose hands are up, who's very animated, her face is very lit up, her eyes are very bright, she's engaged with someone else. That's late stage 4, early stage 5. The lady in the blue who's looking at her, who's got a vacancy on her face and almost has a hostile or suspicious look to her, that's a person in stage 6. And the person in between the 2 ladies, the 3rd lady, that lady is late in stage 6 of the disease. There's no emotion left on her face at all, and she's just blank as she looks out there. One of the things you will notice in your loved one is that at some point you begin to see a vacancy in their eyes, and then it would go away and they would come back. And you've noticed as the disease has progressed that there's greater and greater instances of vacancy. You and I are stage 1 of the staging tool, not because we think you're going to get dementia. We're stage 1 of the staging tool because every staging tool must have a baseline of normal, and you and I are aging normally. We are not going to develop dementia. Dementias are diseases of aging, but they're not normal aging. If you've reached your 60s, the odds are 1 in 14. If you've reached your 80s, the odds are 1 in 6. If you've reached your 90s, the odds are 1 in 2. Now, the good news about living to be in your 90s is you've got a 50-50 chance of aging normally. The bad news about living to be in your 90s is you may very well outlive everyone you know. So people want to live to be a great age. They don't necessarily realize there's a great deal of loss that comes with that. But most of us are going to age normally. Most of us are going to live and die at home. Most of us are going to have not only a full cognitive function, but our brain actually gets thicker and richer as we age. Get the books, The Mature Mind and the Creative Age by Dr. Cohen. These are 2 of the few books written about normal aging, how you and I will really typically age. And they will make you feel empowered because you finally read this is what's really going to happen to most of us. And it makes you feel better. Stage 2 is called mild cognitive impairment. And this person may notice that something's wrong with their memory and actually mention it to you and talk about going to a doctor, but then they will dismiss it and they won't make plans to go to the doctor. And it's so slow and it's so subtle that it's there for a moment and then it's gone in a flash. Now, as a family member, when you're looking at your handouts and you're reading the Dementia Behavioral Assessment tool and you're in stage 2, your first thought may be, oh crap, I've got it too, because it says in stage 2 that you forget names. It doesn't mean my name. It means names you should know, names of your children and your family members. So a person that I know that came to me said, I know I'm having trouble because I can't remember my daughter's middle name, my mother's maiden name, or my PIN number for my bank account. And those are all indicators that there is something going on that's not normal. But it will now be difficult to get that person to go to the physician because they will simply dismiss it as nothing. They'll come up with something else to do and the appointment won't get set. They also may get to a doctor. You may get them to a doctor and tell the doctor, they're telling me they're having memory issues and I'm seeing these little tiny things. But if it's not the right doctor, they won't understand you need a referral to a neurologist and to a testing center to get your loved one completely tested. Stage 3 is where the word dementia is now used in the diagnosis. And remember from your series number 2, dementia is not the final answer. It's no different than telling us cancer. Dementia is the umbrella term. We want to know which dementia it is. Texas uses something called the best practices model, which the state designed. And in it, it lists the 28 tests that are required to do the full dementia testing. And your loved one may not have gotten those things. So remember to use your 9 dementias today and rule out the ones you know your loved one doesn't have. And it lets you go back to the doctor with some more specific questions, because you've got to know which dementia you're dealing with, because it's going to explain for you why they're doing this thing. It's all related back to brain damage, but the type of dementia you have means certain lobes are being damaged differently than other lobes. So the behavior is going to be different. Stages 2 and 3 are the early stages of dementia. This is when medication was intended to be started. The NIH, our National Institutes of Health, believe that if we could start people on medication in stages 2 and 3, that this person would actually live into their old age, die of heart attack or stroke, which is how humans die, but they would not develop the debilitating stages of dementia. Instead, in our country, most people are not diagnosed until stage 5 of the disease. And by stage 5 of the disease, your person's already lost a half a pound of brain tissue. And you would question, why would you give them this medication now that they have such extensive brain damage? And that would be a normal thing to ask. We know that when the medicine is introduced in stage 5, that the person's life through the worst part of the disease is actually extended 2 to 3 years. This is when your person has the most brain damage. So medicine should be started here, but you probably weren't able to get your loved one to the doctor here. The reason they're diagnosed in stage 5 is that's when we can finally get them to go to the doctor. And it's when the doctor may finally see what you've been trying to talk about. So use your staging tools, figure out which dementia you think you're dealing with, encourage your loved one to get tested, get information ready for the doctor, and insist on a referral for testing. Stage 4 is called moderate dementia. This person has moments where they look like something's wrong, and then the rest of the time they seem quite okay. They may become easily agitated if I continue to press them to answer questions because I'm trying to figure out which part of their memory is impaired at this point. They can get really, really angry with me. This person may even make elaborate and complex plans for suicide, but the plans don't make sense. One of the plans that I've heard was, I'm going to get a round trip ticket, fly to Norway, join the Hemlock Society, and then I'll kill myself. And I said, why do you need a round trip ticket? And that completely befuddled him. So he started back at the beginning. I need a round trip ticket to fly to Norway and join the Hemlock Society and kill myself. Don't really need to do all those things, but understand, people with dementia will frequently say to their caregivers, something's wrong with my brain. I just wish I could die. That thought is gone as soon as it's said. But you make sure you take care of medicines. Anything dangerous is locked up. And if your loved one has firing arms, you can have the sheriff's department remove the firing pins so that they still have their gun. They can see their gun. They're not upset, but they also can't do anything to actually hurt themselves. People with dementia in stage 4 have good social skills. Remember, they've still got a lot of brain tissue left here. There's only an ounce or 2 of damage at this point. This person may still be driving a car, still going to work, but they're starting to get in trouble at work. If they belong to a club or another group, they're starting to get left out of stuff because they're beginning to miss things. They're not completing the task they're assigned. Their work is not the way that it used to be. If they play bridge, their bridge game is not the same way. Poker, their poker game is beginning to be affected. And yet, because they don't look sick, friends, doctors, neighbors, people all around you will think that this person is perfectly fine. You may even have your own children or other family members who insist nothing's wrong with the person, or when they're around the person, they actually agitate them by quizzing them. And as we've discussed, quizzing is not done in people with dementia. Stages 5, 6, and 7 are called the late stages and the terminal stages because this is where death is going to occur for most people. A few people will die earlier in stage 2, 3, or 4, but most people with dementia live into stage 5 and 6. Most people with dementia will not survive to stage 7 of the disease, the bedbound stage. They will instead die in stage 5 or stage 6 of heart attack or stroke, just because that's how human beings die. Stage 5, the person is now beginning to accuse others of theft. You're stealing from me. You're taking things from me. And it's because their brain tells them that's where that thing is and they can't find it, but you're here, so you must have taken it. And they can hurt your feelings a lot. Stage 5 people may also turn and rail against their favorite child. Their favorite person may become the focus of anger. And that is a variation of the disease. But be aware of that this is becoming a shell of who you knew. This isn't the mother you knew. This isn't the father you knew. This is now a person that has significant brain damage, and you're seeing bits and pieces of them. They are very busy people. They're hunting and gathering. They go from room to room to room, picking up stuff and going into other rooms and seeing what's going on in there. If your loved one's in a dementia community and they call to complain about this behavior, you need to move your loved one, because this is a normal dementia behavior, and we don't chastise the person and we don't call and chew out the family. This is part of the disease of dementia. Their brain is damaged. They're just busy. Your person may not hunt together. They may be Goldilocks. Goldilocks goes from room to room to room, trying out new beds. And when she finds a soft, comfortable one, she lays down and takes a nap. When she wakes up, the game starts over again. Your person's hippocampus is now significantly damaged, and you're beginning to realize they ask me the same question over and over again, and they're driving you crazy. Stage 5 means your person should be in memory care, or they should be in a nursing home, because their brain now has significant damage and they need to be around medical professionals. And yet you're going to get blowback from family members, from church members or synagogue or neighbors, people who think they know, because they don't spend 24 hours a day with your loved one and they don't see the true disease process. They also don't realize that you're putting your own health at grave risk. In stage 5 of the disease, you're doing the work of 12 people in a community. By stage 6, you're doing the work of 16. If the person's dementia is Lewy body, they will actually accuse their caregiver of stealing from them more in stage 3. In other dementias, it is typically stage 5. And that can feel really embarrassing to you. And understand, as professionals, we recognize this is part of stage 5 of the disease, but we also know people who have taken someone's money or house or car. So we're listening and paying attention to make sure your loved one is getting the proper treatment. But we realize also that that's rare. And most of us are simply doing the best we can for a family member. Stage 5, I've divided into 2 sections because there's so much damage that occurs in stage 5. In the beginning, in the first part of stage 5, your person has the equivalency of a 12-year-old, midway through stage 5, an 8-year-old, at the end of stage 5, a 4-year-old. If you fall asleep at night thinking, my God, I've been taking care of an 80-year-old, 6-year-old all day long, you've been taking care of an 80-year-old in late stage 5. Stage 5 is where bladder incontinence will begin for most people. Stage 6 is where bowel incontinence will begin for most people. But if your loved one has vascular dementia, your loved one may be in stage 5 and have bowel and bladder incontinence as a result of some sort of vascular activity. Your loved one can still fool professionals because of that social conversation of, hi, how are you? Oh, I'm fine. They fool friends and family members that call them on the phone because the family member and the friend has the social conversation. And they don't realize that when your loved one hangs up the phone, they don't know who they were talking to or what they were talking about, because it was a social conversation, simply memorized form, and doesn't really have cognition attached to it. Stage 6 is called severe dementia. And now your loved one finally begins to look physically ill. In stage 6 of the disease, they will begin to lose weight rapidly, and they will lose 1/3 to 1/2 of their body weight. They rapidly begin now to lose words and language skills. Cursing and singing begin to take the place of formal language because of damage in the left temporal lobe. Movement is affected, and they're now shuffling. They're now hunched over. They're becoming more and more withdrawn from us. We call it going into their own little world. They're colder than you and I are, and we should be taking their temperature every month, starting in stage 5 on the same day we do weights, so that we can monitor as their body temperature begins to fall. They become more and more challenging when we do the activities of daily living with them, because they're annoyed by us. They don't understand what we're doing. And if we're doing something especially that involves making them cold, then they're going to push away at us and swat at us. And the movement's actually no different than the same thing you would see with a toddler or an infant. It's just that toddlers and infants don't weigh 160 pounds. So we don't really see this as what it is, which is behavior caused by brain damage. That's what we've always got to remember. They're doing the best they can at this moment with what they're capable of. Stage 6 is where bowel incontinence begins. And in stage 6, this can be especially devastating for family, and it gets harder and harder to visit your loved one. But remember, by visiting your loved one, you are teaching your children, this is what you do for me if something catastrophic happens to me. And the siblings, the families that don't visit, those siblings are teaching their children how to take care of them. So you don't have to worry about that. God will get them. Remember to breathe before you come in to visit your loved one, because it gets harder and harder as the disease progresses. But stage 6 people really like sweet things. So remember all of the tasty things that we enjoy and bring those to share with your loved one. Stage 7 is the bedbound stage, and the medical term for stage 7 is very severe dementia. The person has such significant brain damage at this point that they're now unable to move their body. They're unable to hold their head above their shoulders. It becomes harder and harder for them to eat. The death from dementia is actually death caused by aspirating food particles into the lungs, developing pneumonia. The infection from the pneumonia overwhelms the blood system. The blood becomes poisonous or septic, and septic or poisonous blood causes renal or kidney failure. So the death from dementia, and this is the way Augusta Dieter, Dr. Alzheimer's first patient that he wrote about, died, was she developed aspiration pneumonia, her blood became septic, and she had renal failure. And that is considered the death from dementia. Even in this stage, when your loved one is bedbound, their fall risk continues to go up. Their urinary tract infection risk goes up because now they're immobile. And we don't understand, but they continue to try to get up and move, which causes them to have falls. There's now great difficulty with eating and swallowing. In stage 7, people are typically on pureed food and thickened liquids in order to help them take in nutrition with the least amount of choking hazard. Let's all take a breath. Put your feet on the floor, your hands in your lap. We're going to take 2 deep breaths into the count of 4, hold for 2, breathe out to the count of 6. Everybody, deep breath in, 2, 3, 4, hold, hold, breathe out, 2, 3, 4, 5, 6. Deep breath in, 2, 3, 4, hold, hold, breathe out, 2, 3, 4, 5, 6. I know this is hard material, but you're doing great. These are our 9 most common forms of dementia. These are 98% of all the dementias. The way that you use this tool to help your family, to help your physician, is you do what a doctor does to make a medical diagnosis. You take your person's age, sex, and history. You remove everything it cannot be, and what you're left with is what it must be. If you remember in the first one, I did my mother as an example. So to go through again, my mother's 82 years old. She never played football. I can take off number 9. Number 9, CTE, chronic traumatic encephalopathy, is football dementia. My family doesn't have Huntington's. My mother doesn't have Huntington's. This is passed by the parent to the child, and the child is either has it or they're a carrier. My family doesn't have this, and at 80, in her 80s, my mother's way too old for Huntington's. Wernicke-Korsakoff is alcohol dementia. My mother never had a drink in her life, so she doesn't have alcohol dementia, and she doesn't have Parkinson's disease, so she can't have Parkinson's disease dementia. At 82, my mother's much too old for frontal temporal dementias. Those are the dementias of younger adults. Very few of those people survive into their 60s, so it's not frontal temporal dementia. Lewy body dementia, remember, has strange hallucinations. The person sees children, they see bug spiders, rats, and snakes, they see bad people coming to get them, or they see their caregiver or their spouse having sex with multiple people. My mother doesn't do any of those things, so we can rule out Lewy bodies, but my mother does have a heart condition, a blood pressure condition, cholesterol condition. So I'm going to go back to the doctor with questions about vascular dementia And then vascular conditions tend to be in place maybe over a lifetime. And if somebody has a dementia in place long enough, Alzheimer's will join it as well, and that would become a mixed dementia. So I take this list and go back to the doctor with questions about vascular dementia, late onset Alzheimer's because of my mother's age, or a combination of the two. And that's how you use this tool. So let's look at the dementias. Originally, mixed dementia meant Alzheimer's and vascular dementia only. And then it was realized that Alzheimer's would join any other dementia if the person lived long enough. Then it was realized that any dementia will join any dementia. Lewy body and Parkinson's frequently appear together. Some dementias will only appear if there is already another dementia in place. So some of the frontal temporal dementias only occur if another frontal temporal dementia is happening. And so we begin to realize that mixed dementia could mean anything. You still need to know which dementia is in the mixture. People also can have more than 2 dementias, more than 3 dementias, more than 4 dementias at the same time. I've seen multiple cases where on autopsy, it was confirmed that there were 4 and even 5 separate dementias occurring in this person's brain. The arrows indicate areas of stroke. If you can see the CAT scan, this person has multi-infarct dementia, which means multiple stroke dementia, which is a vascular dementia. They actually have over 4 dozen strokes in this brain. This person had TIAs, transient ischemic attacks. Those are also called tiny strokes, baby strokes, little strokes, mini strokes, pinpoint strokes. They had several dozen of these strokes, and they had them over a long enough period of time that Alzheimer's began as well. So this is a brain with mixed dementias. The white areas indicate where the strokes have occurred, the loss of volume, and the dark areas indicate that Alzheimer's is present and active. The word disease has now been replaced by the word dementia. The word dementia now has the overhead of major neurocognitive disorder. The correct term for Alzheimer's is not Alzheimer's disease, it is dementias of the Alzheimer's type. The correct medical writing for this is that your person has DAT, dementias of the Alzheimer's type. The next question is which form or which domain of DAT does your loved one have? Early onset or younger onset Alzheimer's is younger people. These are people in their 20s, their 30s, their 40s, their 50s. This is one of the things that's most easily confused. The doctor says early onset, the doctor says early stage of dementia, and by the time you get home, you think your 80-year-old grandfather has early onset. Your 80-year-old grandfather can't have early onset. Early onset is people before the age of 60. And remember, in early onset, from the time you see the symptoms until the end of life is typically 3 to 4 years. Only 5% or so of early onset Alzheimer's is actually familial, meaning it is passed through the family line. The vast majority of early onset Alzheimer's are sporadic, meaning that no one in your family has a history of this, and suddenly it occurs in your 35-year-old sister. Down syndrome Alzheimer's is recognized as a domain of Alzheimer's. And the onset of this dementia causes a change in the personality of the person with Down syndrome. And so they go from being this very happy, loving person to someone who's agitated, both can be physically and verbally. Regular onset Alzheimer's is people in their 60s and 70s. Late onset Alzheimer's is people in their 80s and 90s. Regular onset Alzheimer's has 2 subsets, atypical posterior cortical. In this dementia, the person loses their vision slowly, and then frontal variant dementias of the Alzheimer's type. Other variations just in plain old regular onset Alzheimer's is that your person may have delusional behavior, which means beliefs that aren't real, hallucination behavior, persecutory beliefs, they believe people are out to get them. And your person may be aggressive, either physically or verbally, agitated or anxious. And remember, those things should be treated with antidepressant medications and anti-anxiety medications. In late onset Alzheimer's, it now appears that there are 2 forms. One form, I would write the words pleasantly demented. In the second form of late onset Alzheimer's, I would write that this person is agitated. So the second variation of Alzheimer's tends to be one that appears to have more of an agitation to it. Late onset Alzheimer's, remember, is people in their 80s and 90s. This is a normal brain and a brain with Alzheimer's. The Alzheimer's brain, everywhere the picture is dark, that is now cerebral spinal fluid, and there is no more brain tissue there. Vascular dementias have lots of domains. There may be dozens of forms of vascular dementia. A common one is multi-infarct dementia, meaning multiple stroke dementia. Cortical means that the strokes have happened on the outside area of the brain. Subcortical means they're happening on the interior part of the brain. Binswanger is a rare form of vascular dementia in which the walls of the blood vessels are too thick that lead into the brain. Onset of Binswanger is typically in the early 40s, and death occurs within just a few years. The younger a person is with any dementia, the more aggressive it is. The older a person is with any dementia, the slower the dementia is. CADASIL is also an inherited form of vascular dementia. And again, it appears in a person's 40s typically. Death occurs within a few years. Other forms are telling you types of strokes that have happened. And if you see a report on an MRI that talks about gray matter or white matter, they're telling you there is a vascular dementia. Gray matter is the area of the brain you and I think about. It's called that because it's gray. White matter is the area of the brain that connects the neurons to the nerves that come into our body and make our body move as a result of our brain function. So white matter diseases and it's called white matter because the sheathing on the nerve cells is myelin, and that's white. But white matter diseases mean that the connectivity between the brain and the body is corroded. So your person may be more alert in the morning and less alert in the evening. They may be less alert in the morning, more alert in the evening. So be aware that it's not one vascular dementia caused by stroke. There are multiple forms of vascular dementia, and you need to know which one it is, because this is the one that we can help your kids with. This is the one that says, I've really got to exercise, I really got to take care of my body because I've got this inherited thing going on with my family where we have vascular conditions, and vascular conditions can become vascular dementias. The white areas in the brain indicate areas of massive stroke. Person A, their brain has had a massive stroke in the left temporal lobe. Remember, the left temporal lobe is formal language. The right lobe is singing, cussing, and forbidden and ugly words. This person A is probably using cursing to try to communicate and singing because of the amount of damage that's occurred. Remember, it's brain damage causing your loved one to behave these ways. Lewy bodies are dementias that are named for Dr. Lewy, and the Lewy body should live in the fluid of the brain, and instead it somehow moves into a neuron. If it floats in front of the dendrites, the neuron doesn't fire correctly and the person doesn't appear to be thinking clearly. If it moves a little bit, the neuron can fire, the person appears to be normal, and this is called fluctuating cognition. And that can happen because you were taking them to the doctor today, and that excitement of getting up and getting dressed and we're going somewhere can cause more brain chemistry to fire, so that when you get your person to the doctor, they don't see the person you've been living with. They see this person who appears normal. Lewy body dementias have some unique hallucination behaviors as part of their disease process. The 4 hallucinations that we see in people with Lewy bodies that are common are that they see children. The children may be under the bed, they may be on the bed, they may be outside playing. They see children. They see bugs, spiders, rats, and snakes crawling on them and biting them. And in human beings, bugs, spiders, rats, and snakes are something you are hardwired in your primitive brain to be alert to and you don't like. The third hallucination is they see bad people coming to get them. And when they describe them, sometimes it sounds like a SWAT team or an army. Sometimes it's people they know, like a child of theirs, they believe is coming to kill them. The fourth hallucination is that they see their spouse or their caregivers having sex with multiple people. And if you can imagine, if it's the spouse that they're seeing, they're quite annoyed by it. If it is the husband that has Lewy bodies, it's also not unusual that because of this hallucination of seeing his spouse have sex with other people, he will actually get a calendar and make dates for her to have sex with him, because he, after all, is the one who married her. And so his thinking to him is very logical, but the amount of stress it puts on the caregiver spouse is extraordinary. People with Lewy bodies have REM, sleep behavior disorder, which means when they reach deep sleep, they punch and kick violently in their sleep to the point where they may throw themselves out of bed or they may hit or hurt their partner or spouse. People with Lewy bodies have a rapid onset of depression, and Lewy body dementia is the second highest suicide group. Huntington's is the highest suicide group. Lewy bodies is second, and it's connected to this sudden onset of depression, indicating that serotonin is now not being produced or used correctly in their brain. They have trouble with executive function early in the disease process. Executive function is your ability to think and plan through what you need to do today or in the next few minutes. They're a high fall risk. Remember, they fall stiff and straight like a plank landing on their face, or stiff and straight like a plank landing backwards on their head. And they have trouble with visual spatial function much sooner than other forms of dementia. So a person with Lewy body may pull out a chair to sit down, but not move in front of the chair before they sit. So you see trouble with them being able to see the world around them correctly. Their falls are related to fainting, but the fainting is not related to a loss of blood pressure. There is this unexplained loss of consciousness that occurs in people with Lewy body. People with Lewy body are very sensitive to medications, and so you have to be very careful about what they can be given. And they are typically not given the medications that would be given to somebody with Alzheimer's dementia, because they are so sensitive to medications that the reaction is not good. Lewy body starts in a different area of the brain than other forms of dementia, and Lewy body actually mutates. The Lewy body moves into the neuron, what you saw in the earlier cell, and then at some point it balloons, killing the neuron. And those are pictures of Lewy body cells. Frontal temporal dementias are, we consider dementias of younger adults, 20, 30, 40, 50. And I don't mean they get it in their 20s and survive to their 50s. I mean, they get it in that age group and they live 3 to 4 to 8 years afterwards. It depends on how young they are. The first two are behavioral variant and Pick's dementia. And these dementias tend to have more sexual behaviors, more agitation, great loss of empathy, and this person's behaviors are quite different. And the affect loss on their face is so intense that the instinct of caregivers, when they look at this person, maybe this person is dangerous, I should get away from them. And what the caregiver's actually witnessing is frontal lobe damage, means that this person doesn't have emotion on their face. And when people don't have emotion on their face, on their mouth, in their eyes, your instinct tells you danger, danger. These people aren't actually dangerous. They just have a different form of brain damage. Primary progressive aphasia, semantic dementia, and logopenic variant are the communication disorders. How the person stops using language determines which one of these it is. And then the final ones, premotor cortex, corticobasal, FTD with motor neuron, ALS with dementia. These are considered the movement disorders. Prosupernuclear palsy. I said that wrong. These are considered the movement disorder dementias. These people are typically going to be cared for in a nursing home, because a nursing home is the only one that has a Hoyer lift. That's a lift that we use to lift people up. And these are full weighted people for much of the disease. And a nursing home is also more likely to have more staff in the night because they're simply a larger building and community. These people are great fall risk. Remember, they begin to bend. You have a separate staging tool if your loved one has frontal temporal dementia. And normally when I run into families with FTD, they have not been told there are variations of the FTD. So you will go to the website for frontal temporal dementias, and the website is www.theaftd.org. theaftd.org. It's the Association Frontal Temporal Dementia.org. When you go to the frontal temporal dementia website, click on the right-hand top corner onto the menu, and then click on what is FTD. That page will bring up the clinical features of each one of these dementias. And quite honestly, as family members, you'll simply read them and you will immediately say, this is the one my loved one has. And now you know which dementia to track. When you go to your FTD staging tool, you're going to find which dementia it is and then go down that column And if there's an X in the box, it means that behavior is associated with that form of FTD. And you'll just block out the box if you're seeing that behavior in your loved one, and that will let you stage your person as well. This is the brain of a normal person against the brain of a person who has behavioral variant FTD. And as you can see, their frontal lobe is heavily damaged. They are missing their hippocampus. They're missing pieces of their temporal lobe in the front, the middle, and the back. They have significant damage in their parietal lobe. They have holes in their occipital lobe. Everything your loved one is doing is not on purpose. It's not to drive you crazy. It's not pretend, and it's not fake. This is due to brain damage. An easy trick for Alzheimer's versus FTD is people with Alzheimer's don't know who, what, where, when, why, or how, but they have all of their emotions. They're mad at us. They're happy to see us. They're sad. They're surprised. People with FTD know who, what, where, when, why, and how. They just don't care. Their hippocampus isn't damaged until very late in the disease. Parkinson's disease dementia is very similar to Lewy body dementia. These two dementias are considered first cousins of one another. And if our person has Lewy bodies, we are watching for the onset of Parkinson's disease dementia. If your loved one has Parkinson's disease dementia, you're also watching for the onset of Lewy body. These diseases both start in very close areas of the brain. That's why they're so familiar. Parkinson's disease dementia even fall very similar to how Lewy body people do. They're also extremely sensitive to medication. We estimate that 80% of the people with Parkinson's disease will live long enough to develop Parkinson's disease dementia. And the later in life your loved one is diagnosed with Parkinson's disease, the more rapidly it becomes Parkinson's disease dementia. This person's hallucinations tend to be more visual doubling. So they see two of something and realize that's not right. And it's thought also that more detailed hallucinations may be actually related to the medication that people with Parkinson's are given. They tend to be more paranoid, have more of a mask face, meaning the face seems frozen. And there is both muscle stiffness and also the tremor. And so this group is a very high fall risk group, not because people aren't trying, but because of brain damage. Wernicke-Korsakoff is alcohol dementia, and you've got to be honest with the doctor. You've got to tell them if your loved one abused alcohol. We're not judging them. We need to know because this is a different set of testing. Some people with Wernicke-Korsakoff are going to have these funny eye movements, heavy droopy eyelids, poor balance, lack of coordination. They may even appear to be drunk all of the time. In Korsakoff, they're agitated, they're withdrawn, they're difficult to get to come out of their room and do activities with us, and they will do confabulation more than other people with other forms of dementia. And what confabulation is I'm telling you a story, but now my brain realizes that half of that file is missing. And so my brain simply goes to the next available file and fills in the story. And to the family who knows me, well, oh my God, she's lying. I'm not really lying. That takes a 3-pound brain. My brain's just doing this connectivity because it knows there's more of the story. So it just finds me the next story and plugs it in there. And because of that, and because of the history of alcohol, it may be hard for you to go visit your person. You may not want any more contact with them, and that doesn't make you a bad person. This is somebody who may have really been difficult to live with and to be in their life. A quarter of the people with Wernicke-Korsakoff will also smear feces as part of their disease process. Other people with dementia smear feces, not because they're trying to be difficult or make work for us, but because they had a bowel movement and they didn't realize it. They reached behind them, they got some icky on their hands, they're just trying to get the icky off. Other people with dementia have bowel movements in their sleep, and in the process of sleep, they scratch themselves, they move their hands, they touch themselves, and they get up in the morning and there's feces everywhere. Not trying to make your life difficult. It's just the process of dementia. Huntington's disease, Huntington's chorea, and the third one is juvenile Huntington's, because children can begin to develop the symptoms of Huntington's before the age of 18. The youngest we have is children that were 1 and 2 and 3 when they begin to show symptoms. Otherwise, Huntington's disease, Huntington's chorea means the person has the jerking limb movements. The normal calorie count in dementia is we're shooting for 2,500 calories a day and we don't get close to it. Huntington's chorea person has such massive movement and jerking. It's estimated that their calorie count would be closer to 7,000 calories a day. That's twice what a professional football player would eat. And there's no way to get that kind of calorie in this person. This group has the highest, most successful suicide rate because the child knows they either have it or they're a carrier. And if the child doesn't show symptoms before the age of 18, at the age of 18, they are tested if they choose to be, and they know then whether they have it or they're a carrier. If they have it, they know my mother showed symptoms when she was 35 and died when she was 38, that's my trajectory. And so that's why they are successful with suicide. They know they have it, they know what's coming. Whereas other dementias, the person is not that aware because it wasn't inherited and you didn't see what was happening. Hope that made sense for everybody. The final of the 9 dementias that's now been added to this group is chronic traumatic encephalopathy, CTE, or football dementia. This is the only dementia that is graded in 4 stages, the way cancer is graded, but in time, this will also move to 7 stages. There is a young onset and a late onset, and obviously we've got a huge gap of men in that age range of 36 to 59 that are not covered, but that will come in time. There tend to be 4 sets: an aggressive set, communication, movement disorder, or a combination of all of the above. Early onset is men the ages of 18 to 35. Late onset is men in their 60s and above. Anytime I see a football player in high school, college, or professional doing something incredibly ridiculous or stupid or dangerous, I don't think, what a silly, stupid man. My first thought is always, wonder what his brain looks like. By the time, if a boy started playing pee-wee football on the line as a child and was playing tackle football and continues to play on the line through high school, by the time that teenager graduates high school, it's estimated that his brain has actually been involved in over 3,000 head-on collisions of 35 miles an hour or greater. It's also been learned that when your son is struck from the side, the brain actually shears at the brainstem as the result of the impact of the force. We see this starting with boys who played football in the 70s, because in the 70s, boys begin to get bigger. Our population as a whole begin to get larger, and bigger people hit bigger. And so where in the 70s, you wouldn't have seen that many boys over 6 feet tall as seniors in high school, it's not unusual now to see boys and girls over 6 feet tall, even in small high schools. And with that greater age came harder and harder hits. High school football players, junior high football players, pee-wee football players do not have the equipment or the helmets of professional football players. And even though those helmets absorb energy, they do not stop the brain from being hit and moving inside of the cranium, and the brain is not supposed to do that. So football is a very dangerous sport, and the impact of high school, college, and professional level football is the development of CTE. Let's all take a deep breath. Those are your 9 dementias. Mark out the ones that it cannot be. Go back to your doctor to talk about the ones that are left. So I'll just take a deep breath in, feet on the floor. Eyes shut, deep breath in, 2, 3, 4, hold, hold, breathe out, 2, 3, 4, 5, 6. You're doing great. Hang in there.